Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is brought to you thanks to the contributions of colleagues and partners in Wisconsin and across the nation, with support from the Robert Wood Johnson Foundation. It is produced in collaboration with Healthy Places by Design, an organization that advances community-led action and proven strategies to ensure health and well-being for all. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejo since time immemorial. Today, UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, X, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. For your convenience, the QR code will also continue to be displayed for the remainder of this short video. Your facilitators today include our host, Erica Burrows-Girardi, with support from Outreach and Facilitation Specialist, Soraya Williams-Neal, and the Senior Project Director from Healthy Places by Design, Joanne Lee. We invite you to continue the conversation. Join our discussion group immediately after the webinar. Joanne Lee will be our lead facilitator. And watch for a chat from Soraya for details on how to join the group after the webinar.
Welcome to Power Building Approaches for Health and Equity. My name is Erica Burrows-Girardi. Today we will get into the meaning of power and share some practical tips on how you can share power in the work that you do to advance equity and health in your communities. The purpose of our webinars is to share successes, lessons learned, relevant resources, and links. We encourage you to be open to listening to multiple perspectives as we learn together. CHR&R's webinars reflect the values we hold as part of the University of Wisconsin Health Institute, values of collaboration, integrity, excellence, innovation, inclusion, and courage. These are the values that we aim to model during the webinar, and we hope that you will too. With that, I'd like to introduce you to the team that's going to aid in your learning experience today. Let's start with Joanne Lee with Healthy Places by Design. Hey, Joanne.
Hi, Erica, and hello to everybody out there in our audience. We're so grateful that you're joining us today. I'm here to tell you a little bit about how you can join the conversation with us during today's webinar. The first way to engage with us is by using the Q&A box that's in your Zoom menu. Now, just anytime a question comes to mind, you can enter a question there, and I'll be managing which questions we have time to pose live to our presenters. And we'll get to as many questions as we can during today's webinar. You can also engage with other participants using the group chat. Use the group chat to introduce yourselves, as many of you are doing now, to comment on learnings or share your knowledge and experience with today's topic. Now I want to introduce you all to Soraya.
Thanks, Joanne. Hello, everyone. And like Joanne said, I will meet you in the chat. And to participate fully, make sure you set your chat settings to everyone. As you can see, our chat space is lively, and we ask you to adhere to our group agreements for more productive interaction. For more information about our group agreements, you can see our webinar resource page. And now I will like to introduce you to our technologist for today, Erin.
Hi everyone, I'm Erin Schulten. I'm here to help make sure you can see the slides or hear the presenters. So please send us a message to host and panelist in the chat or send a message in the Q&A box if you need some sort of assistance. We're looking forward to today's webinar with everyone. Next, I'll turn it back over to our host, Erica.
Thank you so much, Erin, and thanks to our webinar production team. They are the best, put together the best webinars, and I appreciate you all. Just last month, County Health Rankings and Roadmaps dropped its annual data release. With the release, we debuted a new model of health, new data measures and strategies, and of course, our annual report. So I encourage you to check out those new resources. We're going to be sharing a link to them that will be be shared in the webinar resource guide. This year, our annual report spotlights power, what it is, how it shows up, and how we can use power to create change. This is our new model that I was just telling you about, and it builds on over 2 decades of scholarship and practice, reflecting what we've learned about what creates opportunities for health and equity. Power is so fundamental to health opportunity that our new model boldly places power at its foundation. I encourage you to watch last month's webinar because our co-director, Michael Stevenson, describes the model in detail. Today, we're going to focus on the bottom 2 categories, societal rules and power. The new model names societal rules that shape community conditions. Written rules may be formalized, like documented in laws, policies, regulations, and budgets. Unwritten rules are also very important. They are made up of worldviews, culture, and norms. By naming these rules and where power is held, the model can help local leaders, health builders like yourselves, and organizers make positive changes. Again, you see power at the base of the model because power is the ability to achieve a purpose and to affect change. Power is what is used to create and maintain societal rules. So let's hone in on those unwritten rules I was telling you about because they provide an opening for us to build power. People can build community power when they organize and act together to do things like set agendas, shift public discourse, influence who makes decisions, and cultivate relationships with decision makers. So the question we ask is, how do we organize to create these changes? Like, what does this actually look like? And that's what we're going to unpack with today's guest. So please join me in welcoming María Poblet, the Executive Director of Grassroots Power Project, and Angela Acker, CHR&R's Narrative Infrastructure Team Lead. Welcome, ladies.
Good to be here. Thank you.
Yeah.
I'm ready to have a good time.
Oh, yes. Thank you so much. We're going to have a discussion group right after the webinar to unpack what you heard, what you're going to hear today. So please plan to continue the discussion with us. During the video intro, you heard about our discussion groups that follow the webinar. They're facilitated by Joanne. They're always engaging. They give you the opportunity to share with and learn from others. Several of you have been a member, joined our discussion groups in the past, so you know what they're like. Be on the lookout toward the end of the webinar because Soraya is going to chat out a link so you can join that discussion group right after the webinar. Earlier, you heard me talk about the resource guide that we're going to share. The resource guide includes links to resources that are shared by our guests today and participants from the discussion group. So we will email the guide to you before the end of the week. And with that, I would like to bring María back. Maria, again, thank you so much for joining us. The first question I want to ask you is, why is it important for us to understand power as we adopt strategies that lead to thriving communities? In other words, like, why should public health invest in building and shifting power?
I'll call in one of our ancestors, the Reverend Dr. Martin Luther King, who said this beautiful thing that I couldn't say better. Power, properly understood, is nothing but the ability to achieve purpose. It is the strength required to bring about social, political, and economic change. And one of the great problems of history is that the concepts of love and power have usually been contrasted as opposites, polar opposites, so that love is identified with the resignation of power and power with the denial of love. What is needed is a realization that power without love is reckless and abusive, and love without power is sentimental and anemic. It is precisely this collision of immoral power with powerless morality which constitutes the major crisis of our time.
That is absolutely beautiful. And what I really love about it is that you express that relationship between love and power. So well said. So thank you. And paying homage to Dr. King, who recognized that relationship. Um, Maria, tell us more about Grassroots Power Project. You guys are truly a powerhouse. So I know our audience wants to know more about you.
Grassroots Power Project is an inquiry into power from the social movement perspective, from a perspective that often had only skepticism about power, and over the last decades has been looking into power more deeply. What kind of power do we need? And we believe that our movements have to shift from short-term strategies that win incremental change within the power we have now to long-term strategies that can win structural change and require us to build new power. GPP works to facilitate a shift towards that strategic orientation among a set of community organizations, labor unions, and alignments between them.
Thank you so much for giving us that introduction. And I know that you call it GPP, so I'm going to do it too. I'm going to be lazy and take the acronym. I like it. GPP describes power as having three dimensions or three faces. Can you describe those three faces of power for us?
Well, the starting point of this framework, which comes from the work of Stephen Lukes and Antonio Gramsci and other people who didn't get published before them, is that power is not one-dimensional. It's not a yes or no question whether you have power that you can use. Power is a dynamic. It's a relationship. It's multidimensional. If you think of three faces, one side, two sides, three sides, it's all one, actually. But when we're invested in shifting power dynamics for community health, it's helpful to understand power multidimensionally as opposed to one-dimensionally. This is helpful for organizing. This is helpful for labor unions. This is helpful for anybody trying to make change in the world. We call these three dimensions, three faces. The first one being the most visible, the power to win demands. So this is traditional community organizing logic. You bring people together, you bring resources together, you take direct political action, you increase the number of people and the number of resources involved, you develop leaders, you boost the base's ability to then force those in power to meet our demands. The thing about the first phase of power is you can see it. You can see whether you won or you lost. A good example of this is People's Action Institute's Care Over Cost campaign. They help individuals fight to get treatment when insurers deny it or hold companies accountable when they're denying claims. And those individuals that get help from that group in running those campaigns become part of a community organization that then advocates for work fighting for affordable universal health care for all. And that's first phase. You see whether the claim that was denied got overturned and the service was done. And it's a good measure of our power. You can also see who's making that decision, right? Which is the insurance corporation. The second face is less visible, according to your framework, and the less visible contestations of power is the second and third face. Power to drive the agenda. This relates to movement infrastructure. Are our demands even on the table for discussion? Who determines what's on the table? What's reasonable? This is a less visible form of power, but it shapes the conditions for the first face, for the visible face, right? It requires a strong network or movement infrastructure to have the power to drive the agenda. A couple of examples from your own hometown is the Groundwater Advisory Committee. So this was won through a campaign that then used the three faces of power and very deliberately built bases in rural areas around concentrated animal feeding operations and factory farms. And they created this body that didn't exist before. They have a co-governing academy with county elected leaders. They meet regularly and they strategize. And the whole goal of this body is to implement the waste storage ordinance. And they won the creation of this committee, but there's of course more to go. But this is a kind of infrastructure that didn't exist before, that exists now. Another example, going back to Dr. King's and the civil rights movement, is looking at the vast infrastructure it took to win the Civil Rights Act. And there are entire books written about this, but I'll just offer to you, it wasn't just one thing at one time, right? Yeah. Here is the NAACP, the Southern Christian Leadership Conference, the role that celebrities played, labor unions. Millions of dollars got moved to movement organizations from philanthropy and individual people. Black churches played a leadership role. There were associations of physicians. There were local organizations. There were militant organizations like the Deacons for Defense. There were youth organizations like the Student Nonviolent Coordinating Committee. There were training institutions like the Highlander Center. These are all part of the infrastructure that made possible the visible win of the Civil Rights Act.
Yeah, when I saw this slide, I was like, wow, physicians were part of the civil rights movement. And I know that some people, think of, well, public health was part of the civil rights movement. Well, yeah, it was. I mean, the civil rights movement uncovered disparities in health just as it did education, income, housing, and more. And physicians were often present to treat marchers as they were injured, and physicians were visiting the homes and visiting the communities where people in the South where people were being disenfranchised. And these physicians actually organized, like you were saying, to form that medical committee for civil rights. And guess what else I learned, y'all? The committee, along with the National Medical Association, which it represents African American physicians even today, they advocated for the creation of community health centers. We now know those community health centers as federally qualified healthcare centers. So, I mean, it's just important to know that public health is a part of a lot of the movements that have made America the world leader that it is today. And Maria, you're talking about how infrastructure is part of that second face of power. I think it's kind of evident even today that without infrastructure, a lot of the systems that we have can actually fall apart or be dismantled. So infrastructure is a very, very powerful, a very, very important face of power. And so thank you for highlighting how important infrastructure is. And some folks say, well, speaking of infrastructure, public health is in a crisis right now, right? Because we are seeing some of our infrastructure kind of fall apart. So how can we leverage a crucial moment in time, like a crisis, to contend with power?
Well, think about a crisis in your life and how much it changes your identity, right? who you are, what you're capable of, what power you can leverage. It all gets revealed in crisis. This is true for individuals. This is true for whole societies. This is whole for countries. This relates to the third face of power, which is about shaping common sense. We talk about it as making meaning on the terrain of ideology and worldview. But if you want a smaller mouthful, how do we think about what we want? How do we think about what we deserve? How do we think about what other people want or what other people deserve? This face of power is about the beliefs, the values, the ideas that shape our understanding of the world and our experience in it. And we, as organizers and as members of a community, we can take on this face of power explicitly. So aiming to change common sense, because common sense doesn't come out of the blue. Common sense is built through experiences. It relates to good sense and sometimes not, right? So taking on this question of what are the stories or the dominant narratives about what we're working on, and how do we relate to those explicitly instead of just functioning within that environment without attempting to influence that often invisible face of power. Here's some dominant narratives that are told about government programs, which most of you all have experience with. You have the idea that government programs are inherently wasteful and or that they create laziness as a moral condition. There's the fictive welfare queen, which was a very deeply racialized and gendered concept, when in fact, most people that are benefiting from government assistance are white. But this was a wedge driven on the terrain of worldview to then drive privatization. And here's another one about wasteful government programs. Very common in the news today is the idea that government programs are so inherently wasteful and that the country should be run like a business. And that's an idea about what government is for, and that those narratives are being debated in the public arena right now. And this is a moment for the shaping of our identity. Who are we? Who can we count on? What are we capable of? Crises reveal our power, and they open up space for us to make meaning differently than we did before. We can break or build alliances. We can create a new common sense of who we are. And our idea is that we could build a bigger we, and we could contest on the question, what and who is government for?
Yeah. And so with that, Maria, can you give an example of how we in public health can use these three faces of power in the work that we do?
So on the first face, whether or not it's your formal role, you can organize community members to advocate for public health policies or for changes in the approach to public health. You can engage in direct political action in different roles in your lives: lobbying, protests, public awareness campaigns, kitchen table meetings, church basement meetings. You can partner with community organizations that are doing this kind of work and strengthen their work. On the second phase, you can build a strong network to ensure public health issues are considered and discussed and important. You can influence which issues are prioritized, what's deemed reasonable for discussion when it comes to public health. You could establish a committee or an advisory group that includes community members, that influences public health policy decisions, and that builds new infrastructure for community power over public health. And on the third phase, on this question of making meaning, you can influence public perception and understanding of public health by shaping narratives and ideology and not just functioning in response to them. You can address core values and beliefs that your community has that are deeply embedded in public health. You can help shape people's understanding of health and well-being and bring out their deepest solidarities and desire for health for everybody. You can challenge negative narratives about government programs and promote stories that highlight the positive impact of public health initiatives, who benefits from it, why it strengthens our communities. And I'm sure all of you are involved in experiments in this direction. There's no one way because there's so many dimensions, but there's so many opportunities.
They really are. And I know those of us in public health often can't lobby. So I do want to revisit that because that probably set off some alarm bells when you said that. But we can advocate, we can educate. So that is definitely something that we can do. And that's a power that we hold because we have information about, just like what you said, Maria, about what's needed to create conditions for people to make healthy choices rather. Another question I want to ask you about, and I think we're going to end with this question but it's a good one. Um, I know that GPP believes that to create change that we should commit to long-term strategies. First of all, how would you describe the difference between a short and a long-term strategy, and why should public health invest more into that long-term strategy?
So I would say a short-term approach to social change is a transaction. It relies on the power you currently have and the options for change that are on the table right now. Going back to that care over cost campaign from the People's Action
Mhm.
Institute, fighting one case at a time for insurance companies to cover care is crucial to people's lives. And it recruits people into the movement and helps them to find common cause with each other. But by itself, it doesn't change the conditions that cause the denials of care. Short-term strategies are important and even urgent, but by themselves, they're insufficient. A long-term approach is transformational instead of transactional. It depends on changing the power dynamics and putting power in the hands of those who need change the most. Building organizations that are fighting for care, holding insurance companies accountable changes the power dynamics. It makes it possible to fight collectively. Another obvious example of this is labor unions. If the nurses have a union, the conditions for the patients are better. These are institutions of second phase power. And then you can contend for bigger, more structural changes that make a difference for a longer period or for even generations. In community and labor organizing, we call this strategic practice, an approach to community organizing and labor organizing that's oriented towards long-term transformation of social and economic relationships in our society, as opposed to focusing only on short-term policy wins. And I would say, from to close with another movement ancestor, Eduardo Galeano, a Uruguayan writer, he said, while we can't guess what will become of the world, we can imagine what we would like it to become. Without the right to dream and the waters that give it to drink, the other rights would die of thirst.
Oh, so beautiful. So true. Thank you so much, Maria. I'm sure there's lots of questions that folks have, so stick around. Right now, I want to bring Angela back. So welcome back, Angela. First, remind us what narrative is and how it's expressed in everyday life.
Yeah, and thanks to Maria for making my job really easy and setting me up. Narratives are the themes of stories we tell, rooted in what and who we value. Narratives help us understand the world, our place in it, and how we make decisions. If you want to know how narratives are expressed, just look around you. You can
Mm.
find narratives where you live, learn, play, work, and worship. We operate on narratives every single day, whether you are aware of them or not. And I loved how my colleague Jed Amaral talked about this in February's webinar. So please check that out. But whether it is policies passed, media we consume, our conversations at the dinner table, we filter events in our lives through narratives to help us make sense of the world. And so I love this quote here by Miriam Kaba. She coined the phrase hope as a discipline. In one interview, she stated, "I don't have hope, I do hope. It is an
Mm,
active process that I commit to daily. It's not an emotion, it's a practice, and it helps you navigate difficult times." For me, narrative change is a mix of both art and science that shifts our practice to hope. It is more than strategic communication. Changing narratives is an organizing tool. This process helps us to name what we want, to organize around core values and agendas, to interrogate the status quo so
mhm.
that we offer up new possibilities. It is a long-term strategy that changes the trajectory of what's possible for a lifetime and generations to come. So by understanding and being intentional about how we use narrative change, then we can build hope within ourselves, within organizations, within our communities. And as we practice hope, we can wield our collective power to create the future that we want, a future where everyone can thrive.
Yeah. Yeah, I love the fact that you talk about narrative being part of the long-term strategy because it starts with what we believe, what we hold dear, what we hold true, and what we value, and how we make sure that those values are expressed in our work, not for the moment, but for the future that we want to create. So it's a long-term strategy. I definitely see that. And
Right.
it also lives in one of those faces of power that Maria described, that third face of power. And public health can use this third face of power effectively. Um, the question is, how do we embed narrative into our strategies, into our long strategies? How do we embed it in that? That's a question we get a lot. So can you briefly describe how that works?
Yes, Erica, and just a reminder of what Maria was talking about is the third phase of influencing how we see the world and making what's currently deemed impossible common sense. So that's what narrative change does. It makes the impossible common sense. And narrative change offers the public a choice, another option to see the world in a different way. So instead of seeing the world where everyone should look out for themselves, we can
Mhm.
then lean on narratives rooted in caring for each other, loving every person regardless of their identities. We can acknowledge that in this society that everyone has worth. And as Fannie Lou Hamer said, no one is free until we all are free. But it is more than just offering another option that happens to be on the menu, right? As a patron of a restaurant, you don't necessarily see all the inner workings in the kitchen. But look, I've been binge watched way too much Top Chef, so I'm here to help you out here. So in the kitchen, you have a head chef, you have a team of other chefs or cooks who have selected and gathered ingredients for the night. From there, the team designs the menu, and only then do they prepare what becomes the delicious meals that they can offer on that menu. It's a process. And so, with narrative change, that process involves selecting key ingredients or values to develop your new items on that menu, and those are the narratives.
Wow, I like that.
I
I'm
know, I
telling you,
love it too. I
because the
love
food
thinking
metaphor
through
really
process
works for
and
me.
food, right? But thinking through that process, you'll see on this next slide, before you embed narratives into your work, you have to both identify narratives that are creating harm and maintaining the status quo. And you have to develop new narratives or narratives that reflect the values where everyone can thrive, or as we like to call them, transformative narratives. Because oftentimes, those narratives aren't necessarily new, but it's the narratives that we need to prioritize. is. So Narratives for Health walks people through this process in our Train the Facilitator series that we adapted from Dave Mann. Dave Mann actually was formerly a strategic advisor for GPP. So we are students of GPP. But it is important to know that narrative change must occur in relationship. After building trusted relationships, then are we then building and developing a shared understanding of narrative, naming which narratives are creating harm and which narratives and values do we share with our partners that we can then use to go after what we want for our communities, for our country, and for our world. And so after you develop a shared transformative narrative, then you apply narratives to everything that you do, from framing data to changing how you evaluate, what questions are you asking, informing your strategic communications strategy, shifting how you shape agendas, policy briefs in your training strategy programs. For example, let's go back to the one example of transformative narrative, everyone has worth. This emphasizes treating people with dignity, valuing a wide array of perspectives, especially from lived experiences of oppression, and loving your neighbor. If we truly believe this, if we truly prioritize this, what messages and stories could resonate in your communities that reflect this narrative? Who are we valuing in our strategy, in our policies, in our organizations, in the way we govern? You can change your processes and organize your partners within and or outside your organization to reflect the values that you share.
Yeah, I love that. And I love how you have mapped out all of these processes because in public health, this is all part of the work that we do. And I just love the way you showed. You can actually make sure one narrative, that you just took one example, but you can make sure that multiple transformative narratives are threaded throughout the work that you do. Yeah, wonderful. So can you share a couple of examples of how communities, how organizations are actually doing this? What does it look like when they're building narrative into their strategies?
Sure, Erica, it's all about weaving it in. And at Narratives for Health, we've seen many ways where folks are shifting power through narrative change. And Narratives for Health is co-led by Human Impact Partners and University of Wisconsin Population Health Institute. And since 2021, we found that public health organizations, big and small, urban and rural, have been able to apply narratives in changing organizational culture. They've been engaging media and using narratives to shape stories and messages. Organizations have embedded narratives in their external strategy with community and state plans, briefs, policy recommendations, and more. And you can find more of those examples at Narratives for Health and also in the resource guide that we'll share with you today. And this is just the beginning, right? We have a growing community of public health practitioners continuing to learn together, build relationships, apply narrative in their work. And if you're interested in learning more, you can also join us. And there will be another Train the Facilitator soon in September.
Oh, awesome. I'm actually gonna show a slide with more where they can get more information to join that
Awesome.
training. So yeah. Let's talk a little bit about how we in public health rather can use narrative to expand our partnerships, to include organizing groups like the ones that GPP um, would represent or would partner with. So how can we bring public health and organizing together with narrative?
Yeah, and I'm going to take the long way around to answer this question, Erica, so bear with me here. As public health practitioners, many of us now tend to be risk averse when it comes to advocacy. In general, we'll see the line, as you see on the screen, and particularly thinking about lobbying restrictions in current climates. Um, we're cautiously or sometimes even preemptively taking 20 steps back to make sure we are compliant. And immediately when we hear partner with organizing groups, alarms may like just start popping up. And you may say, "Oh, that's too political for my organization." And with funding cuts and sweeping layoffs, being cautious is both natural and understandable. However, I do want us to encourage ourselves to remember who we were when public health was just beginning to professionalize. And so this was back when W.E.B. Du Bois was both scholar and activist, one of the founders of NAACP. He was also an author of arguably one of the most important studies that detailed how biology didn't predetermine Black Americans' fate, but conditions did, specifically social, economic conditions, and racism, and how it impacted Black Americans' health and well-being. The Roots of Public Health was born out of collaboration among advocates for people experiencing poverty, housing and environmental advocates, scientists, and physicians. So we cannot forget the work of people like Florence Kelly. She advocated for labor reform, workers' rights, child labor laws, and linking labor practice with public health. Advocacy can take many shapes and forms. It can take the shape of sharing data and how we link conditions and societal rules to health, what narratives we use, who we partner with. Public health and advocacy is not new, it's in our roots. And partnering with organizers and organizing groups is not in our distant memory either. There are growing numbers of public health organizations across the country who are expanding their partnerships, including with organizing groups. CHR&R highlights one such example in a recent blog of a partnership between a state health department and a faith-based organizing group. And this collaborative did wonderful things by centering transformative narratives that shape their messages like, we are healthiest if we all are healthy together. Increasing income will help reduce stress and improve lives. These using these narratives and shaping the messages with narratives led to their ability to pass policies around paid family leave and a child tax credit and advocating for a livable wage. Another example that I offer, COVID-19 pandemic. We were there. We saw this during the height of the pandemic. We began to see health departments partnering with community organizations, organizing groups, and community health workers, entities deeply rooted, have deep relationships with communities that health departments needed to reach.
Mm.
Expanding partnerships led to the ability for information, mutual aid, and services to reach the people who needed it most. So, shifting narratives around who should and who is valued to shape decisions can shift your practice and how you expand those partnerships. That is a narrative shift. And
Mm.
even if you are unable to work as a representative of an organization, remember you wear several hats. As a parent, as a student, you are also a part of the community. You are a community member too. So get to know your organizing groups in your local community and see how you can plug in.
Wow. Thank you for, yeah, thank you. We have so many opportunities. Don't limit yourself. Like you said, we have so many opportunities to change the world, even within our own small space. It starts with us.
It starts with
So,
us. And I'll leave you with this. And then I know we have to wrap up soon. I see the time clicking. No one organization, no one sector can do this alone. One thing that I'm taking to heart right now is to think about, and in thinking about public health's role in power building, is how geese migrate. So, in order for geese to get to their destination, the birds actually rotate who leads the flock. This creates both momentum and it also prevents burnout. Public health doesn't always have to be in the front. Maybe public health rotates to the back. Maybe we are flying side by side. But the most important position that we can be in right now is present, in partnership with others who are building and shifting power, building trust and relationships, actively listening. utilizing everyone's strengths in our public health ecosystem, which, let's be honest, organizing groups are very much a part of, are all ways to build community power. This includes shifting narratives that maintain systems that have long harmed us all. So, public health practitioners partnering with organizing groups is not new. We've done it before. Some of us are doing it now, and we can all do it again.
Yeah, I appreciate you closing with that. Thank you so much, Angela. As you begin, make sure you pop your questions into the Q&A pod because I'm getting ready to transfer it over to Joanne to manage that. But I do know, Angela, earlier you were talking about some training. We're going to have these links in the resource guide. But as you heard, we have a training coming up even in September. I didn't even know it was coming up that soon. So you want to make sure that you're on the waiting list if you want to get some in-depth training about how you can use narrative in your public health work, how you can embed it into your long-term strategies. What Angela just shared is just scratching the surface, but the training will actually give you more information. So we'll make sure these links are available to you on the resource guide. And with that, I am going to ask Joanna, let us know what questions have been popping up.
All right. Well, definitely, Erica, our presenters got folks motivated, inspired. So the quotes and just the very positive, uplifting messages clearly resonated with our audience. And I'm going to start with you, Angela, because it sort of is on the coattails of what you just mentioned about the importance of partnerships in creating really what we need to do with changing narratives. It's building a groundswell. And to build a groundswell, like you said, one agency can't do that alone. And someone in our audience also noted that perhaps in smaller communities or where there may be situations where a state government agency or public health department doesn't have very active advocacy groups nearby to partner with or work together with. So are there alternatives to maybe the more traditional advocacy groups that you might suggest that state government agencies should partner with?
Yeah, and I would like to offer so I was recently in connection with Praxis Project, and so they have base building organizations that they work with. Um, and there are rural communities that have organizing groups too. Um, it just may look a little bit differently. So even if you're like big or small, there may be other ways of advocacy. Even think about an on-ramp with schools and your PTA. That's a way to continue to like make sure that your voice is heard. So even if there's not necessarily a labeled organizing group, see who has who opens the door with your community. Who, I don't like to say gatekeep necessarily, but who are those trusted members in your community, and what is the base that they're building? So what are the groups that are involved in your community, and what actions and what solutions are they advocating for?
Mm-hmm.
And so they might not necessarily call themselves an organizing group. They may call themselves a community group, or they may call themselves a community power building group. But just interrogate, go and explore, and see. And they may be some state groups, there may be very local groups, and just see the ways that you can plug in.
Yeah, so a couple of things I just want to lift up is you're really expanding the definition of advocacy. Because the other thing is you can do it in informal ways. See who has the ear of the people that make decisions in the community, right? Or who has the attention of the people who influence decision makers. And decision makers may not always be elected officials, where there are more restrictions around advocating, right, for government agencies, but they may be very influential business people who kind of set practice or leaders of major organizations. Yeah.
Right.
All right,
Yeah.
Angela, I'm going to come back to you. But Maria, please come back to the screen as well. Because you did such a wonderful job of really inspiring folks around power building approaches for health and equity and why it's really important. And so, at this time, at this moment in our country and communities, what opportunities are you seeing for public health specifically to engage in power building approaches?
Well, I would offer that as federal funding is being threatened or cut, there is an opportunity to do bottom up healthcare advocacy, provision, communities of support. And in the community organizing sector, there's examples of combining service provision and organizing that is interesting to think about from the public health perspective. I come out of work around gentrification and displacement in the Bay Area, and there's an organization in Boston that does a similar format, which is people can come in to get information about what their rights and responsibilities are as tenants. Is this eviction legal? Can I get my sink fixed? How do I do that? And in that same process, they come into contact with other people who are having similar issues. Sometimes people in the same building or with the same landlord or dealing with the same building inspection commission. And then you can create the basis for some policy change by organizing those people together. In Boston, City Life, Vida Urbana calls this the sword and the shield. The shield to protect people and the sword to make new room. And I think public health already has some of this logic built into this. Even on this webinar, we uncovered earlier how some of the infrastructure that we work within and that shapes our work was won by generations before and by those movement struggles generations before. What infrastructure now do we intend to leave behind for those who come next?
Maria, you just have such a beautiful way with words and pulling quotes that are not only inspiring and touch the head and the heart, but easy to remember. So I like that sword and the shield. Thank you so much. Angela, I'm gonna. Oh, Erica, are we out of time? No, you're just going back to that
No, it's
helpful
Maria.
visual.
Yeah, Maria had shared this slide with us earlier. We didn't think we'd have time to share the slide, but since she referenced it, I wanted to make sure you all saw it. It is in your slide packet. So you do have it in your slide packet. I just wanted to go ahead and pop it up.
Great. Thanks for that. All right, Angela, I'm going to bring you back because this is a fun question, I think, for you. You know, you and I always talk about blue sky thinking when we're talking about transformative narratives. Like, let's not limit ourselves of the possibilities because other people might try to limit us, but let's not start with limiting ourselves. So, this is a great question from our audience, and that is, Angela, if you had funding, what would you do first to develop narrative change or build community power in communities?
Oh, that is a fun question, isn't it? Um,
But you have to pick the first thing you would do.
only the first thing that I would do is join Narratives for Health. That's what I would do. But I think it goes a little bit deeper than that, right? I think the beauty of Narratives for Health is that like what you were saying, Joanne, it's easy to get caught up in the today. It's easy to get caught up in what's going wrong in the world and forget our strengths and forget hope. To forget to imagine and reimagine what we can do together when we shift power and collectively go after what we want. And so I think that that is where we always start, is to start with what values do we share and what do we want and name it clearly. My grandma, who she would always say, make it plain. Just make it plain. You know,
Mm.
write out your vision, write out those values that you share, and continue going forward. So if I have funding today, I would make sure to do that.
Great. Now I have a final question for both you and Maria. I want you to each to take less than a minute to answer this question, but it's another fun one. So I think it was Maria who shared the quote. This is for you too, Angela. This is the quote, "Hope is a discipline." That we shouldn't approach hope as something we have, but something we do. And so how would you each answer this question? How do we practice hope and not have it, but do it?
In southern Mexico, actually where this shirt comes from, um, this is like actually this is worldview and ideology from the Mayan people about the Ojo de Dios. And from that history, in the social movements today, they take the framework of caminar preguntando, which means we ask questions while walking. We keep moving forward and we take our questions with us. We don't stop to find the perfect answer before we do something. And we also don't walk without trying to ask the big questions. So this is how I am approaching it right now. And just take a step forward, take the question with me, and remember that there are people who came before that made the room for us to do this now. And think about the room we're making for those who come next, to keep walking, to keep asking.
Thank you. Angela, how do we practice hope?
So, Maria, I'm going to continue that. It's bringing those others in the room, whether it's your ancestors, whether it's your faith, um, even your children. So I think also about my 6-year-old daughter. I think about lessons learned from Native communities that look 7 generations ahead and not just today. So I also think about what is the world that I want my kid to live in. And as sure as heck, it's not this one. It's not a world where, you can't go down every street and see safety and feel safe. It's not a world where people are divided. Um, it's a world where everybody, everything can thrive. And it's a world where my daughter can walk around and be free, and that she can be free with her friends and her friends' friends and her friends' friends. And so that is what I do from time to time when I feel like, oh crap, um, it's getting real, real. And I look at my daughter and her smiling face, and I think about what world I want her to live in, and I go for it from there.
Thank you both so much. Yes, Angela, you almost made me lose it. When I think of sweet, sweet Dahlia, and the world that we all want for her and that generation. Thank you both. You are getting lots of love in the chat, and including for your grandmother too, Angela. But Erica, I'll turn it back to you.
Thank you so much, Joanne. And for whoever posed that question, it was a beautiful question. Thank you. And yes, you can't see it here, but I'm really fighting back tears. Just so beautiful. Um, this is the world where we all want to see, and quite frankly, it's a world I believe that was designed for us, and we can make this happen. So with that, I'm asking Soraya to please share the link to our survey. And please let us know how we did. We are always curious to know whether or not we have been able to provide you with information that you can use in your work. So we please ask that you complete the survey. I'm so excited to share that next month's webinar will focus on harnessing power. Yes, we're going to revisit power because it's so important. Remember, it's at the foundation of our model. So we're going to focus on harnessing power to drive policy change. And policy change, folks, is a written rule. Remember, we talked a lot about the unwritten rules today. We talked about infrastructure, setting agendas, the power of narrative, and how you embed the unwritten rules into the work that you do. Next month, we're talking about written rules. So we will be joined by Mackenzie Kalbeck with the Oklahoma Public Health Association, along with Jamie Crespo from Change Lab Solutions. So register for that today. And of course, we have our discussion group that's going to follow this webinar. I am excited to say that both Angela and Maria are joining us for the discussion group. So you'll have a chance to actually be in conversation with them one-on-one. Soraya's chatting out the link so you can join us in the discussion group. And lastly, the best way to learn about our resources and upcoming webinars, podcast episodes, all the tools and resources we have is to sign up for our newsletter. You can also follow us on social. So, hey, listen, folks, I know this is a really tough time to be doing the work that we do, but change starts with you, and we can do this. Thank you for doing everything that you can to build health and equity in the communities that you serve. And I hope to see you in the discussion group and definitely here next month. Thank you, thank you, thank you.